Thank you everyone for coming. So I get to talk to you guys a little bit about changing your culture and improving your outcomes for your clinic. And I know everyone here is coming from a different setting, different clinic, different size. And the idea behind this is to give you some general information about different cultures and unique attributes of companies, maybe not in healthcare and also in healthcare, that we may want to model our clinics around. We want to talk about millennials because we're going to want to attract those people as clients or patients, and we're also going to want to attract the best ones as our employees. And finally, we're going to talk about adopting the best of breed management, and that's going to be more discussing different ways to schedule, lean processes and what that means, data being your friend, efficiency studies, also talking about when it comes to the employee, what do you actually share with them in your business? What should they know? Because they should know some business basics. So first we'll start up on culture and unique attributes of some great companies. Some of you may have used this company to book your stay, or you probably used maybe the hotel. This is Airbnb. So Airbnb, if you don't know, that's like a search engine to find somewhere that you can rent or list your house or condo in order for someone to use it. Their main location is in San Francisco, but their customer service or customer support is in Portland. And I had the opportunity of going, and not going there for like a business thing. It was actually going as a physical therapist to educate them about physical therapy and how that might help with their ergonomics. But when I walked in there, it was not what I expected to see, right? So this is what it looks like when you walk in there to their customer support, which they call customer experience. And what immediately struck my attention was that this looks like a kitchen and not some place where you do customer support. So I was kind of wowed by that. You can see that the dress is very, very, very lax. And the age was kind of that millennial range, which is around 18 to 34. They also have a lot of really good things to spoil their employees. They have on-site catering, Airbnb catering, and you can see that, again, very lax dress, long tables where people can interact. You don't have to bring your own. You don't have to bring your own lunch if you don't want to. They have daily meditation. They have monthly events, which was one of my things as a physical therapist, coming in and educating them about physical therapy. They have snacks, beverages, and beer. It's all free. And then finally, they have Airbnb and credit when they go to different areas for vacation. They basically can stay for free and use the product that they actually represent. So kind of cool. I was pretty blown away. So then when I left, I was thinking, wow, is this normal for a company to do all this stuff for their employees? And I thought, yes, because I thought about tech companies in general, and they have to promote creativity because they're going to make the next product that's going to change millions and even billions of people's lives. All right, so YouTube has an awesome slide that you can slide down when you're at the end of the day. Google has some amazing, you can Google and see some amazing recreational rooms that they can have for their people to relax. So it didn't really surprise me, but then I started thinking about it, and the weird thing was that their customer service or customer support or customer experience, it doesn't require the same creativity as those companies and what they're doing. That customer support and customer experience, the big thought idea, that's all happening in San Francisco, not in the Portland-based clinic. So you look at this picture, again, this is Airbnb there. They have like a house inside their building. And you think about space and wasted space and things like that. That's a lot of wasted space, but they do it. So the question was why? That's what that came up to my mind. And there was three things that when I talked to these people, they divulged to me. And it was first that they loved working for Airbnb. The second thing was that they got paid less or had to take a pay cut to work for them, and that was like fully divulged information. I didn't ask them or anything, and almost all of them told me that. And then they loved that they got to work with a team and the perks of Airbnb. So that got me thinking a little bit about, again, why Airbnb was doing this. And I was thinking about how I could take this across to physical therapy. And the three things that came up to me was, it's not about the money, it's about the experience. And I thought about, for physical therapy, again, fellowships, right? So fellowships, a lot of people will take less pay in order to get great mentorship to become a better physical therapist faster. Okay, that works for me. Creativity was fostered. And like I said before, this customer support doesn't need that creativity. There's a lot of workflows in place that if someone doesn't know the answer, they send it to the next person who does know the answer. But in our profession, in order to drive our profession forward and improve our outcomes, we need to have creativity. And the last thing was that working as a team was a high priority. And I know physical therapists, because I'm coming from a physical therapy background, we love our autonomy, but at the same time, we also really value working as a team. And I just want to ask you guys, like personally, how often do you really get to collaborate on something creative with another physical therapist? And I don't mean like, in passing, talking about a patient that's complex, or at lunch when you're trying to document and eat and then talk back and forth. I'm talking about like really sitting down and doing something special, maybe not even just one patient specific, but on a greater scale, because that's what Airbnb is kind of fostering. So just something to think about. The next company I want to talk about is Uber. And again, if you don't know, Uber is that company that you can basically, it's like ride sharing. You can become a taxi driver and get paid for it. So the 3 things they have on their main website: make good money, drive when you want, no office, no boss. So the first thing I got from that was, you're the boss. And the millennials like that. They like to feel like they have some autonomy and their time is actually valued. The hours are flexible, so as an Uber driver, you can drive for an hour or you can drive for 80 hours in the week. It just depends on you. And again, what we'll talk about with millennials is that they really, really value their time, and they know that that's one of the most important things that they have. So that flexibility is very, very nice. So then again, I thought, what can we do what can we take to incorporate that in our physical therapy practice? So autonomy needs to be valued, obviously. Employees want to be the boss, and when I was writing this slide, I was thinking about how I have a lot of friends, not just in physical therapy, but in like HR positions and other aspects that maybe they want to be the boss, but they're not really ready yet, but they still think they are. And I'm sure that you have some employees that you can probably think up at the top of the head that maybe are like that too. But it's important to know that that's going to keep going faster and faster. Millennials with technology being faster and faster, they're picking things up faster and faster, and they're going to think that they can do something maybe they're not quite ready for, but maybe you can build them into actually performing. And then the last thing is profit sharing or a stake in the company. If you want to keep good millennials, you're going to have to incentivize them, and what better way than to give them some of the business? And I know that's sometimes scary for some owners, but I think it's a great way to share. Uber, 80% of what the fare is goes to the actual person driving, 20% goes to Uber itself, and they're doing just fine. So let's move on to the healthcare sector and what's different in healthcare now and the culture that's being fostered. Zoom or Zoom Care, you'll hear me say both because I'm used to saying Zoom Care, but they just changed themselves to Zoom or Zoom Plus. They want healthcare to be more like an Apple store. And I thought that was really interesting. And what you'll see with these pictures is that this company it basically looks like an Apple store when you walk in, even though it's a primary care walk-in clinic. So their motto is to be a complete healthcare system designed to make you happier, healthier, smarter, faster, sexier, and more creative. And they say, use it every day, yes, every day. So I think about that for a second, and I'm like, you don't use healthcare every day, right? You use it when basically you're hurt, not preventative care. And I guess we're trying to move that way, but I haven't seen it quite that much yet. And if you think about them trying to be Apple, what I think about is them saying, you may not come into the clinic every single day, but you're going to use an app or something that we have, that we created to look at your blood pressure, to count your steps, to count your calories. We're going to be your healthcare in one place. So, founded in 2006, there's 22 locations, and actually they have one in Seattle now, so it's not just Oregon. And they just became an insurance too, so now you can get Zoom Care insurance. This is all just in Portland and now in Washington, and they're just going to keep growing. So 2006, and now they have 22 locations. So why are they different? Well, healthcare on demand is their main motto, but there's no waiting. It's easy appointment scheduling. Walk-ins have very, very little wait, and then it's a different feeling than the typical medical setting. So if I put that picture up and didn't tell you that it was Zoom or Zoom Care. I would personally think that's like an Apple store or some kind of technology store. But it's not. That's their dental office, and they're going to eventually have a surgery center too. But that's their dental office, and they post all of their cash pay rates right in front. You can just see it. It doesn't change. They have the times on there too, which I don't know if a lot of clinics do that as much, especially in PT. So what's different about them? They use extensive use of nurse practitioners and also physician's assistants. They also have integration to medical specialists, so you're not going to see an MD for your primary care visit, but they do integrate those specialists. They have integration of mental health, and they also use naturopaths in Oregon. I think there's 16 states that naturopaths can practice in as primary care providers and get reimbursed through insurance, and Oregon's one of them. So we have a lot of them, and I work with a lot of naturopaths. Other differences with them is that their prescriptions are dispensed and filled in the clinic, so then one less thing to worry about. I don't have to go to Rite Aid or Walmart or any of those places to fill my prescription. I can just do it right there. They accept most insurances. They publish their prices like you saw in that picture. They have primary and chronic care, and they also have episodic care that they provide. And then I think the last cool thing that they talked about was that they can actually follow the patient into the hospital via their hospital concierge program, and that's a really unique attribute that I think that is going to take hold, and people are going to want to expect that. So we're going to stop there with Zoom Care for a second, and we're going to go back to them later on, because we're going to talk about how they do their scheduling. Because when you look at their scheduling, it's going to look like they don't see anybody, because they have so many openings, and how they do that. But let's go to millennials. What we want to address is that you better pay attention to them, and we'll talk about why, but basically the answer is that they're the biggest workforce in America right now. Special considerations for us is that the doctor of physical therapist, who's the millennial, we're going to talk about them in our profession, what's important to them, the business basics side, what they need to know in business, and then finally transparency, what you should tell them or the importance of transparency in your business, which sometimes can be scary. So 1 in 3 Americans in the workforce are millennials, and in 2005 they surpassed Generation X to become the largest workforce, and there's 53.5 million millennials working right now, which is pretty amazing. It's important for physical therapists and companies to pay attention because physical therapy was rated one of the best jobs for millennials in 2015. With a median salary of about $80,000 and projected hiring outlook of 36%. And then by 2030, the millennials are going to outnumber the baby boomers by 22 million people. I love this picture. I Googled physical therapy, and that's what I got. I don't do a lot of like shoulder impingement, arm raising. It's just like, that's ridiculous. So I put it in the slide. So with that DPT comes a certain persona, and I've heard a lot of people who have a bachelor's in PT or master's in PT kind of voice their concerns about DPTs coming in and being a little more, let's say, cocky or think they know a little bit more than they really do. And that whole idea that they're a doctor and they should be paid like one, which we know we can't do because reimbursement is just going down in general. And it's important to get them on your side and for them to know that it's not, you as an owner, you're not being stingy. You just know that you can't because reimbursement's going down. You have to retain some kind of profit. But I do also caution you guys to think about, just because they have that air of cockiness is not necessarily a bad thing in our profession. I think that's something that we've lacked for a while. And in order to push our whole profession forward, sometimes you gotta be a little bit bullheaded and stick your nose out there and say how good you are. So it's not necessarily the worst thing in the world. Maybe we can foster it and actually grow it into something and not have that whole disconnect. Because if they're pushing our profession, we're gonna get to be able to get better reimbursement. We're gonna be able to see patients easier with better access. We just gotta keep driving and tell everyone how good we are. So millennials in our profession, things that I teach a class at Pacific University in Oregon, Forest Grove, if you've ever been out there, which most of you probably haven't. And I always tell them the first day about the salary ceiling and how it's getting lower for a new PT, and just telling them why. And that's huge for them. They ask a lot of questions. They get a little bit mad about, insurance and reimbursement. How come we're not getting reimbursed better? And, I'm talking about being your own advocate, being a huge, getting involved with the APTA or your state and local chapter. But yeah, so that's just like a side note with that. But the model of work more and get paid is not as appealing as it once was to millennials too. That was something that really started when women joined the medical field at a bigger rate, and they wanted to have children and start families and things like that. And the MDs and that whole idea of trying to do production-based and get paid more because you worked harder started going out the window, and people wanted to be specialists because they just had more time to take off in order to raise a family and things like that. Well, the whole millennial generation is feeling that same way. They want to have some kind of work-life balance, and that's important for any company to realize. Employees want to feel like they're spoiled by their employer. It's hard to sometimes think about how to spoil them, but I'm going to tell you right now, the stuffication, it's just a word that was made up. It's not about stuff. You don't want to spoil them with stuff. It's about experiences. So you don't have to spend a lot of money to spoil your employees. What you do is you have to be creative, and you have to actually take the time, and maybe that means taking some time out of the work schedule, even though it's going to cost you a little bit of money and revenue, to gain those experiences in order to keep the good millennials. And in the long run, it might actually save you money because they may not care as much about their money, like we talked about. It wasn't about the money, it was about the experience. So overall, your actual overhead when it comes to salary will be lower, and that's going to save you money in the long run with really good physical therapists that you're going to keep growing as millennials. So we talked about their balance in work life that they really like, and they also really like to embrace change. So if they're on board with your change, they're going to follow you right through it, and they're going to be pretty good at adapting, and that's something I think all generations coming up are going to be better at. They're just going to be faster at embracing change. Technology is very important, so we're at Clinicient, and if you're still doing paper charts, you got to stop. You just have to. Just because I've had friends that they went to a really good PT clinic, they loved it, and then they say, but they still do paper charts, and it's like, got to get with the times. Everybody's doing this, and it's going to be more important with things like meaningful use, where everyone's going to have to be integrated with that. Importance of critical thinking is big. So if you say that's the way we've always done it, then that's not going to fly with the new millennial PT. Millennials are not Generation Y, but at the same time, people think of them as Generation WHY because they ask a lot of questions, and sometimes that can frustrate people. But it's good because you should always be asking how your processes are going and why you do something, right? The importance of feedback is very important, so I definitely recommend, if we're going to retain good millennial PTs, having some kind of formal residency. And that doesn't mean that you have to just, bring someone in or train a fellow and then start a curriculum and do it all yourself in-house. There are pretty good places or companies that you can bring in now that have formal residencies to bring them up into the OCS or bring them in becoming a fellow of orthopedic manual therapy that are relatively cheap because they're using internet basically and coursework through that, taking quizzes, and then the only cost besides obviously the cost of gaining access to that internet database is for them to fly out and then treat on the weekend, show those manual skills to your company. And it's way, way, way more cost effective. So if you don't have that set up in place, think about it because I really do think that you're going to retain a lot more people that way. And also, just as a side note, workload pressures and production expectations should be secondary during the residency. That's going to, if they're good and they become good with their interpersonal skills, they're going to get a ton more patients. Then you're not going to worry about productivity and workflow and workload. They're going to get all that stuff as they get better and better at being a physical therapist. So wait on them. Give them a little bit of time. Next thing I want to talk about is a lean process, which we'll talk about lean a little bit later too, but it's push versus pull. And the reason why I bring this up is for starting to think about how you create your culture and your workflow to appeal to the millennial PT and also just employees in general. And I think the best thing for me to do is use the hyperlink here for the person that he doesn't have, like, it's kind of bad audio, but he does a pretty good job explaining what push versus pull is in the workplace. And I'll give you an example if I can actually pull this up.
Chain of paperclips. In a push process, step 1, paperclip 1, does its work and sends the finished job on to step 2, whether it's ready for it or not, and so on down the line. One good thing about the push process is that usually everybody is busy, and business owners all around the world like to see people busy. A bad thing, however, is that if there is an imbalance in the process chain, then the work piles up, just like it would if you pushed a chain. This wastes money, and business owners all around the world don't like that. In a pull process, the customer demands the work from the last process, which then causes the process before to demand work, and so on down the chain. The good thing about this is that you don't tend to have piles of work sitting around, and you respond quickly to the customer's needs. Business owners all around the world like this. The bad thing about the pull process is that if you have an issue with any one of the links, then very quickly people have to stop working, either because they have nothing to work on or their customer isn't demanding any work. So they both have pluses and minuses. But which one is better? The accepted wisdom now is that pull wins. Why? Well, a big problem with push is that you pay all the time. Whilst you push, there'll be work piled up and wasting money. It's insidious too, because all this waste hides behind busy people. Pull wins for a few reasons. You only pay when you have an issue, you're better connected to your customer, and because business owners dislike paying people who aren't adding value, the problems exposed when people in the pull process stop working tend to get fixed faster.
Okay, so let's think about that from not a marketing perspective, but more internal network, internal process of your clinic. Let's talk about the initial paperwork for a physical therapist, or for a physical therapist to see. So let's say a client or patient comes in, they do their initial intake, and then they give it to the front office person. The front office person, thinking that they are doing something good, walks back to the physical therapist's office and hands them that initial paperwork. So that physical therapist, let's say hopefully isn't treating the person at that time, but is finishing a note really quickly. And then she or he is interrupted by the front office person. She or he says thank you because it's nice that the person gave it to the person, but at the same time something was interrupted. They were either finishing something or the paperwork was pushed onto them. So that would be a push process. A pull process would be that initial paperwork's finished, that front office person takes it, puts it in a file folder with the therapist's name on it in the front. The therapist then finishes their note, walks up to the front, grabs the paperwork and pulls it out when she or he is ready, reads it on her time or his time, and then greets that patient and walks them back to the clinic. So that's the difference between a push versus pull. And that's like the difference between that pile of paperwork you see stacked up on all those pictures when you look at people just tired and they throw more stacks of paper on. That's a push process. They keep loading them up and they just keep working over and over and over again, and they just become tired and fed up. And we'll talk about how that messes up downtime, which is another lean process too. So what should you tell the staff physical therapist about business, about business and business basics? And the big ones that I want to talk about are charges do not equal reimbursement, which anyone in management and also who are owners are like, no duh. But I didn't know this when I was coming out of PT school. I think they taught me about it, but I didn't pay any attention. Fixed costs, gross margin. PT is not a path to riches. It's really important to get that across in multiple ways, but not to scare them. And then transparency, giving some kind of transparency for your clinic because they want to know that. This is just an example, and this is near and dear to my heart, of the charges are not equal to reimbursement. Before I started my practice, I accidentally stumbled upon what I was charging per month, and it wasn't this, but I remember being like, oh my God, I charge $32,000 in a month. how am I making just $60,000 in my salary? I'm getting screwed here. And I see that the net payments is 17,000 or 18,000 approximately, and I see that there's an adjustments, but I don't really know what that means. What I think is that $32,000 is probably coming in at some point. They've just only gotten 18,000 so far. So I'm immediately kind of flustered by that. So it's really important to tell people, why do we have these weird charging systems where we charge like an astronomical amount of money, and then the insurance says, no, you can't because you signed this contract, and why that even happens. That's really important for them to get a good grasp on, and maybe say it. You can't just say it once. You actually have to tell them a few times, and it'll actually be good for that physical therapist in the long run because they're going to have a better conversation with the patient about that, and also maybe eventually learning about deductibles, copays, and coinsurances, which they're going to have to know more about whether they like it or not, because deductibles are only going to go up. And that means that the therapist is going to have a conversation with someone during that initial evaluation when the patient says, well, I have a $5,000 deductible, so how long do you think this is going to last? And they're like, that's something for the front office. I don't deal with that. That's not going to fly. Fixed costs. So these are just off the top of my head. Rent, insurance, and workers' comp, which is variable because you do an audit at the end of the year if you have more people. Staff salaries. That's you don't have to tell them what it is, but it's important to tell them that the number that they see on paper of what they're getting paid is not what it costs for the clinic. So again, let's take that $60,000 range. If that's what you're making, don't forget about vacation, medical, dental, continuing education. That $60,000 goes up very quickly because of all those things. And they don't know that, and I never thought about it too when I was first coming out of school. I just thought it was on paper, and then I got more mad because I realized that taxes are really, there's a lot of taxes out there. So I'm like, I'm not even making the money that I thought I was going to get. So finally, EMR, that can be a fixed cost, and then variable if you have billing intermixed with your EMR. And then I just wanted to tell you, point out that you have to remember that these new grads might have paid everything in loans for basically their entire adult life, and they may not have a very good idea of what fixed and variable costs are. That doesn't mean that they're bad with their money. It means that they've never ever been able to actually change the fact that any of their outcome when it comes to payment. If you want to be a PT, you got to go to your undergrad, and you're going to have to pay for it no matter what, and you got to pay for rent. If you want to be a PT, you have to go to grad school, and you're going to have to pay for it. You're going to have to pay for lodging. You're going to have to pay for the books. You're going to have to pay for the technology. It just doesn't matter. So why do I really need to make anything when I know that I'm going to have to pull it out with loans anyway? So this stuff may be almost brand new to them, which is kind of scary, but just the way it is. Gross margin is something to have a discussion with because it's important for them to know that you have to have something at the end of the year for a few reasons. One, you have to have your company grow, and that gets reinvested. And also, let's say the staff physical therapist has been there for 25 years. They're kind of at the max when it comes to that staff salary. And then let's say now they have a boatload of vacation time. They're actually maybe costing more than they're actually taking in. They probably aren't, but they're probably pretty close. That's all built into that profit, that gross margin. So explain what that is, explain what a healthy gross margin is as well, and also talking about how that can be something for a rainy day, because we know healthcare is changing really quickly, and we don't know which way it's going. Hopefully it's for the better for PT. There's mixed reviews on that. This is an example of US Physical Therapy, which is a publicly traded PT company. And you can see that their gross margin their gross profit margin is around 24 or 25%. And looking at Pfizer, theirs is around 87 to 76%, which is kind of like comparing apples to oranges in general too, because they're different service sectors. But it's just an example of how you can talk about that path to riches is not necessarily in physical therapy, because there are other companies that have larger gross margins. Other things to talk about when it comes to those costs for being a physical therapy clinic. The cost of living is going up, which I think is a really good way for you to transition and say, and so is the cost of renting a space. That's going to go up too. Costs for materials are going up. More federally mandated policies, which is going to increase the costs for healthcare clinics. I mean, hospitals have already felt the crunch on this. and it's going to be coming to those outpatient clinics as well. But hospitals have gotten burned a lot because of the new Affordable Care Act and different things they have to implement. Deductibles are going up like we talked about. And then finally, reimbursements are going down. Not the greatest graphs that you want to see. So one thing to tell them is that physical therapy is going to give you a healthy salary, but it's not going to make you 1% rich. You're not going to be the 1%, unless you just create something crazy. But being a staff physical therapist, that's not an option. So that leads us all to just talking about transparency. And the big thing that PTs, millennial PTs, and PTs in general don't like secrecy. So they need to know that they're not being cheated, because their idea is that they're making all the money, right? They're building it, so they're seeing all the patients, so they want to know a little bit. So giving them that transparency gives them a stake in the company. So if you're not comfortable with doing profit sharing or something along those lines, just allowing them that information is a really nice way to kind of cut it down the middle. All right, so now we're going to get on to breed management, and I'm going to tell you that some of this stuff, there's like laws of statistics, and there's graphs, and that stuff scares me. So don't be scared by the numbers. I don't know if anyone got to hear Karen Hughes yesterday, but she talked a lot about statistical process control and lean processes in general. I'm going to talk about it from a little bit lower level so that I can understand a little more conceptually that way. But first, we're going to talk about just the attention to detail and how hospitals have already got a lot of efficiency information that you just have to pull up, and it's not that hard. Use Google Scholar. Inventory, and how much I basically don't like it. Scheduling, and that's basically Zoom Care and how they do their scheduling. And then lean strategy. So we're going to go over a few just examples of efficiency studies. This one was interesting because it talked about implementing electronic medical records. And the conclusion, this is all in your presentation booklets too, so take it home. You don't have to read it, but I'll give you the summary. The conclusion was that in the systematic review, that when you implement it, if you took the metrics from when you initially, like you first implement it, and then you take metrics on if it improved your workflow and your documentation time, it showed that it did. But then if you implemented it, waited some time, and then took the metrics to see if it improved, there wasn't a big difference between paper charting. That's not really the point though, because you need to do it, because then you can actually read people's chart notes and things like that, and it just looks cleaner. And because of meaningful use, everyone's gonna have to be on it in the future anyway. But the other thing that was interesting about the studies that they said was that they identified the need for having bedside or centralized stations for doing your EHR. And I think about that with physical therapy, and I think about putting a kiosk that people can access, that physical therapists can access and document while they're working with the patient, because that's like the hardest thing, right? We don't want to document on the patient's time because we think it's rude. We're staring at a computer screen. I'm very manual therapy based, so I gotta get my hands on them. I gotta actually feel what's going on. So maybe we can kind of go in between and set up these kiosks so that they can easily, swipe and log on and review something with the patient. Maybe it's an exercise. Watch them, be standing, talking with them, documenting really quickly, swipe down, they're done, and that's going to improve your documentation time. This one was for distractions. I just thought it was very interesting too, and different ways to address distractions. This was for a centralized medication station, and they talked about using different kind of barriers in order to decrease distraction. But the other thing I liked that they talked about was setting up some human factors, like different ways that you could train your staff to identify distractions before they happen, and then also address them in a certain way, which I think is really good, because then I, again, go back to physical therapy, and I think like that front office that just gets inundated with people no matter what you try. The phone's going off the hook. You got the people in front of the front office, people that are trying to check them out. You got the physical therapist who needs to get their attention too. And how do you address that? Because you need to be more efficient in that. Otherwise, the front office person is going to be completely burnt out as well. And hospital studies have already done this stuff, a lot of this stuff for you. You just have to access the information. They have more money. I love this one because this one can give you a ton of information. This was about 36 hospitals that used time motion capturing to just figure out what nurses did during the day. And it was genius because they took that data And they identified all the things they did and 3 main things. And that was they spent most of their time, 35% on documentation. Medication administration was 17%, and care coordination was 20.6%. Okay? And then it's actually kind of funny because only 7.2% was actually patient assessment and reading of vital signs. It's not very much. But then the conclusion, which is a no-duh conclusion, was that there was 3 main targets for improving efficiency: documentation, medication administration, and care coordination. But that's awesome, because if you're trying to change your culture, appeal to those millennials, be more efficient, millennials can go home and have a better work-life balance, and you're like, where do we start? I don't know where to go. This might actually be a good way to start right here, and it's actually more efficient. We can use a GoPro or something, time-lapse it, and actually see what PTs are doing throughout their day. If you can identify even 1 or 2 things that they spend most of their time on, why don't you work on improving that efficiency right there? Because you're probably gonna make a huge difference to them. So I thought that was really neat. This was just to prove that when I talk about lean strategies in Six Sigma, that it's real and that it actually does work. This was for an operating room, and they implemented lean strategies, which included process mapping, which we won't talk about, but it's basically just mapping out how things happen, finding delays and fixing them. Leadership support, staff engagement, sharing performance metrics, which you should definitely do for your staff physical therapists. And they said that there were substantial gains that were sustainable and positive financially. And the best thing they said was that it was transferable to all specialties. So physical therapy is no different. Lean strategies can totally be implemented with physical therapy. This was another one talking about operating room efficiency. And basically to take away from this, they said that they use data. Conclusion was by using data, they were able to identify problems in the workflows that they could then address. And my point with that is that the next slide, data is your friend. Don't be afraid of data, and it's going to help you with things like wait times. So my example in this is wait times. How do you know what your wait time is for a clinic? How do you know if something you did actually improved or helped? Or maybe it was just a random chance. How do you account for variability between therapists? And the answer is statistical process control, SPC. Like I said, it's a little scary because the next slide is a graph, and my heart just flutters. But it's really not that hard. Karen said that she told people who were there before that you have to think of every dot on here as a patient experience, that every dot is a patient. And there's 3 lines. There's an upper control limit, a center line, and a lower control limit. So the center line is just like your mean of, let's say, wait times. And these are all people that waited. So let's say they took from when the front office person took time when the person stepped into the door to when they were greeted by the physical therapist. Okay? And they map that out. You can make your own. There's stats to make upper control limits and lower control limits, but you can make your own if you want. So let's say your threshold, you want every patient to not wait any longer than 10 minutes. So that's your upper control limit. And let's say with your lower control limit, you want it to be 0. Let's say 0. The therapist is already waiting for them when they walk in the door, and you're averaging around 5 minutes. That's that green line. So what you do is you have your average because you did actual data points. So you have to get the data first, and you can do that different ways. You can do one physical therapist over the course of a few days or weeks. You can do all your physical therapists and plot that out as well. You just have to create enough data points, and then you can implement a change and see if it actually makes a trending difference. And there's different ways that you can look for trends. And I won't talk about that specifically because it can get pretty deep, but you can, again, look this stuff up online first, and then you can go to a class if you want to know more about it. It's really important, though, because what you can do eventually is change the control limits. Once you change something to make your wait times better and faster, and it's actually a trend that's going down, you can tell the times are going down, you can change your upper control levels and your lower control levels, which means instead of making it, let's say now the center line is at 2 minutes because you changed your processes and it's going down now. Now we can make our upper control limit, let's say 4 minutes, and then we can make our lower control limit still at 0. And so you're narrowing the margins. You keep narrowing them and narrowing them and narrowing them until you're basically hitting that, let's say 2 minutes is what you want every single time. I mean, hospitals are already doing this stuff. So you don't have, and it doesn't have to be a ton of data at first, just a little bit over time, figuring that stuff out and at least knowing where you're at, and if it's really making a change at all. Inventory, again, how much do you really need? It's an infringement on lean processes. I utilize good DME reps, durable medical equipment. If you know that they're going to get you that stuff in 2 days and they're going to be consistently doing that, minimize your overhead and just order it when you need to. And then stick to the small stuff, I think, when it comes to storing it, because it's just wasting space. We bought some equipment from a PT that was in a business owner for 30 years, and I mean, there was stuff there that was started when he was starting 30 years ago, and it was just so outdated, never been used, and somebody paid for it, which was him, and then it wasted space too. So you can push product and you can sell that stuff, but try and keep it small. Scheduling, this is the future of scheduling. People don't want to wait, they want their healthcare on demand. And a clinic with a full schedule is good, but it actually could potentially be better. That goes with like the millennial idea. I talked to someone else about this and they said, well, I wait 30 minutes I come 30 minutes early for my doctor's appointment and I expect to do that. And that's not going to be the future though. Millennials are going to walk in and they're going to expect to be seen because Zoom and urgent cares are already doing it. So they're going to get used to that. And so we need to be ready for that as well. So what we can try and do is implement advanced access. Going back to Zoom care, when I log on and try to schedule an appointment, first of all, it tells me the closest clinic to me without me typing in my address. It just takes my IP address, realizes where I am, which is kind of scary, and then tells me the closest one. And then I have a person that I'm actually seeing that could be the person that I choose to see. And the clinic must either just started or been really slow because she's open the entire day. But they have 22 locations, so that can't be possible, right? Because they're doing pretty well. So how do they have so much opportunity for people to be seen? Well, one thing they do is, so let's just talk about how they implemented it first. They have a full service website, which includes full profiles on every clinician. The pre-registration and browse and scheduling a provider are all online. It's quick and easy. They have extended hours of service. And then they also have telemedicine, which you can't reimburse for insurance yet. At least I can't in Oregon. But you can ask for money, cash pay, and that's one of the big things that they do. What they use is advanced access scheduling. And in order to implement this, you have to do a few things. But you need to know it's an operating marketing advantage just to begin with, because you can market that people get same-day treatment. You can implement advanced access. I'll talk a little bit about implementing advanced access, and then we'll talk about some metrics in general to look at if advanced access is working for you. So traditional scheduling systems, that's like first come, first serve. You usually have long times until your next appointment. There's a lot of high no-show rates, so I know that everyone's talked about no-show and cancellation rates. That's like, unless your clinic's just operating perfectly, I've always heard this from every clinic I've been to. How do we reduce our no-show and cancellation rates? Sometimes people get double and triple booked. It's a little harder in PT because you bill per unit, but to try and squeeze them in. With advanced access, the patients are seeing the same day's requests. There's reduced no-shows because they made the request on their time, or they can just walk in. And they have better continuity of care because they're actually seen immediately when they need to, versus a really good clinic that's 3 months booked out and somebody's hurt and they can't get in, and then you try and squeeze them in on someone's lunch. It's just not as good. So in order to implement it, you have to obtain buy-in, and not just from the physical therapist and the staff, but also from the management, that this is actually something that's going to work. You have to predict demand, so that goes with that data. You got to know the demand. You got to predict capacity, which deals with Little's law, and I put that up in a couple slides. Don't get too scared about it. It's just a stat law that's really interesting. And you have to standardize and minimize the types of visit times, because you can't, in advanced access, you can't have like your choice of a 40-minute session and a 60-minute session. Or I know that some fee-for-service, or cash-based practices will do it based on the minute, like it's a certain dollar per minute. That's not going to work for advanced access because you need to keep it the same time every single time, the same price. Then you have to assess your operations, make sure you're ready for it. Work down the backlog, which means, again, you got a big clinic, it's doing really well, it's 3 months booked out. Well, that doesn't work for advanced access because there's no schedule. You can't make any more scheduling, so you got to work that backlog down somehow. Then you go live, and going live doesn't mean that all physical therapists now don't have, any schedule. The idea could be just one. You create a 4-hour block of part of the day where the PT has no patients, and then the rest of their afternoon is scheduled with patients. You do have scheduling, specific times and dates for the in advanced access scheduling. You just try and not have as much as a 3-month wait. So this is Little's Law. I don't want to get too into it, but the point about it was just that you can actually, when it comes to predicting your capacity and what capacity you actually have in your clinic, you can use it. And you can change the formula up a little bit. So just one example was that if a clinic serves 200 patients in an 8-hour day, that's 25 patients per hour. If the average number of people waiting in a waiting room are 15, then you just take 15 divided by 25, and you have 0.6 hours in the clinic that people are sitting there and waiting. So you can identify capacity and waiting times just by using something like that. It gets a little bit harder as you keep going into that stat, but it's pretty cool, and it's pretty consistent at being able to predict it. Advanced access metrics that you want to look at. PT match is the percentage of same-day patients who see their PT, so they just want to see Bryan. It's important to know. PT coverage is the percentage of same-day patients that want to see just a PT in general. That's really good because you start to actually realize what do your customers actually want. Do they just trust that you're a PT, you know what you're doing, and I don't care who I see, I don't care if it's the same person each time, or do they want to see the same person each and every single time for a greater maybe continuity of care. You want to know the wait times for your next appointment. You want to look at good backlog, so there's good and bad backlog, and good backlog is that scheduling in advance because of patient preference. The bad backlog is appointments that are delayed because there's lack of slots. So that's a fine balancing act. And you can look more of that stuff up yourself too. Was that good? Everybody kind of understand that? My point of this is to go, use these slides, go back to your clinics and look through them. I don't care if you Google them, Wikipedia, this stuff. It's to give you the knowledge of, what to look for in the first place and things that you might be able to implement in your system. And that's the last stuff we're going to talk about is lean processes. This is already happening again in the hospital. We need to get on this. So the goal of lean is to identify what is value and what is waste in your company. So you want to eliminate non-value added steps, and you want to streamline the customer value added steps. You want to eliminate all waste, and then you want to minimize the essential non-value added steps, which what that means is like a government policy. So you have to do it. It costs your company money in order to implement it, but in order to stay compliant, you have to do it. So just keep those at a minimum, and then everything else that's not value added needs to get thrown away. Toyota was the first group that actually did this, and so they have a very interesting business model that a lot of people use now. Definitely look them up because, they make every car one at a time. They don't build multiple parts and then put them all together. They do a pull process where every car is pulled down the line and they make it one at a time to eliminate waste. It's really interesting. So what is value add? Value add is something that consumers are willing to pay for. They have to, there must be an activity provided or that improves the service to the customer's expectations. It must transform the form, fit, or function of a product, and it must be done correctly the first time. And I typically think, value add for PTs is the PT, and how good they are, and if it fits their need and their time. So what I think about instead is actually looking at the downtime, which is the waste. How to identify waste in your clinic first, because I think the value add is pretty obvious for the most part. And what lean processes do is they made something called downtime, which is defects, overproduction, waiting, not utilizing employee talent, transportation, inventory, motion by workers, and extra processing. Some of these things are going to not be PT specific, but there could be something that every clinic has that they could probably change. So defects is an effort that are caused by rework, scrap, and incorrect information. So I think about, first thing that popped in my head was pre-authorization and messing up on that, and then having someone have to redo it, or then retro auth, or then not actually getting paid because you didn't get the retro auth in on time, or they don't even retro auth. I don't know if anyone has CareCore or EviCore that they have to deal with, but we have to deal with in Oregon for Blue Cross Blue Shield. It's a nightmare. That's what I think about when it's defects. So poor quality control, poor documentation, lack of standards, missing processes, and poor control over the inventory. Those are ways that defects happen. Overproduction. Remember, Toyota makes every car basically one at a time. This is production that is more than it's needed or before it's needed. When I think of PT, I don't necessarily see the physical therapist doing that maybe as much, just because you see each person one at a time. But I think about the front office, and maybe there's something in the front office that is being overproduced that they don't need to yet. And that's going to be dependent on your clinic. Waiting. This is wasted time waiting for the next step in a process. And that is from insufficient staffing, poor communications, long setup times, mismatched production rates, and poor shop layout. So, if your staffing isn't correct, there's going to be people waiting, whether it's going to be your patient or it's going to be the aide or the assistant or the PT. There's going to be a lot of wasted time waiting for something. Not using employee creativity. We talked about millennials and how much they like to be creative and they like to help. So if you underutilize the patient's talents, skills, and knowledge, you're not utilizing their talent. And you're not going to effectively engage that employee. So now you're looking at lack of teamwork, lack of training, poor communication, not including employees in problem solving, and then finally, narrowly defined jobs and operations. So that's something to really be thinking about. How do we utilize our employees actually better for ideas? With Toyota, the other thing that's cool about Lean is that all decisions are basically made by the employee, not by the business administration, staffing, management people. They get like 3 million ideas from their employees every single year or something. And it could be as simple as, this pencil is over here and it should be over here. If I had it here, then I could do this faster. It's like that simple sometimes. And they use all that. The executives look at it, the managers look at it, and they implement it. So it's all from their employees. And they had to change the whole culture because the employees were afraid that they'd be fired. Like, their jobs become, obsolete. So Toyota was like, we're not going to fire anybody. We'll just put you in a different job. Maybe we'll even promote you. So it's a whole business culture that's very interesting. The managers aren't the ones with the ideas. It's the employees that do the things from day to day. Transportation. I think about this sometimes about how long it takes for the patient to get to your office. If you have a good PT clinic, they'll come from all around. But Zoom Care or Zoom, they're 22 locations. They put them right in different neighborhoods. Small clinics in neighborhoods, so you can just walk there. You minimize that transportation. But this also has to do with goods too. So they talk about poor office and plant layout, poor design systems, and unnecessary steps in a system process, which can lead to more transportation. Inventory, you've already kind of heard how much I don't like it. So try and minimize as much as you can. I know it's hard. Motion by workers is the M. I find this one really interesting, and the time motion capturing could be really fascinating. So an example of this, let's say that you have exercise balls in one corner, dumbbells in another corner, okay? And the physical therapists use both a lot. And maybe it takes 10 seconds for them to go from the exercise balls to the dumbbells to do it. But if you multiply that by how many days they're in the clinic, how many weeks they work, how many years they're there, that starts to add up. And if you use that motion capturing system, just for a day and identify those things, if you just move those over a little bit so that they're right next to each other, you're automatically reducing the motion by workers. And so, again, we're talking about workspace layout. That was an example for physical therapists. Ergonomic issues, searching for misplaced items. I need to get better at that. I lose things all the time. A congestion and lack of standards. And then finally, we got extra processing. This one, when I first learned about it, I thought was really interesting because it's just something that is maybe too good that the customer doesn't need. And then I always try and bring things back to physical therapy. And I'm like, okay, so this is like an 80-year-old woman with a total knee replacement, and she just wants to get around and do functional activities around the house. And you're like, I'm going to put her on an Ultra G, and we're going to get her to run, you know? And you're like, and there's no reason for her to run. She never wants to run. There's a lot of precautions and contraindications you need to look at too. But it's about that over quality. You know, like you don't need that much quality. And I'm a big proponent of having the most, you know, the best quality for your customer. But maybe you need to look at what they really need and what is quality to them. And so that's just what extra processing is. So just in summary, we talked about different cultures and unique attributes that are out there already, both in the healthcare field and not in the healthcare field. We talked about millennials and how they're going to be important as your clients and as your patients to grow your clinic and also keep good millennial PTs. And we talked about breed management, the importance of business basics. We talked about statistical processing control. And then we finally talked about lean processes and what downtime is and what value add and non-value add is. I know it's a lot, but again, circle something that you find interesting. Just look it up and then see if you can take some of that stuff and implement it into your clinics at your respective locations. That's it. Questions? Thank you.
What is it something about millennials, or is it something about your generation? And I've got two children, 22 and 24, so they're right in that mix. But is it something about the way, the environment that we're in, that they feel that way? Because I'm trying to think what I was back then. I wasn't thinking that.
Yeah.
On the other hand, there weren't private practices back then either when I started,
I think
I
think it has to do completely with environment. So let's go back to the stuffication idea. The iPhone, okay, that's a thing. That's stuff. But what does our generation use an iPhone for? Is to share experiences, right? It's about Facebook. It's about Snapchat. It's about Instagram. It's about sharing experiences and not feeling, let's say, cheated because someone else is doing something cool. Like, I want to show that I'm doing something cool too. And I'm being transparent. I'm showing my entire life. And then you go into business and then it's like, wait, they're not telling me anything about that. Like, I want to know more about that. I share everything else. So it's a disconnect between what they do in their day-to-day operations and how they live their life and what they share versus in a business that's usually been kind of like, it's business. We keep it kind of under wraps and we just let the managers deal with it. So yeah, I think it's an environment thing.